America is in the grip of a silent killer. It's not a virus or a foreign enemy, it's drug abuse. This epidemic has seeped into every corner of our nation. From bustling cities to quiet rural towns, no community is immune. The problem is vast and complex. It affects people of all ages, races, and backgrounds. Drug abuse is tearing families apart and destroying lives. The numbers are staggering. In 2019, nearly 71,000 Americans died from drug overdoses. That's more than the number of U.S. soldiers who died in the entire Vietnam War. It's like losing a small city every year. And for every death, countless others suffer. They struggle with addiction, health problems, and broken relationships. The problem keeps growing, despite efforts to stop it. Drug abuse isn't just about illegal drugs anymore. Prescription painkillers have become a major part of the crisis. Doctors once thought these pills were safe. Now we know better. Many people who would never touch illegal drugs have fallen into addiction through these prescriptions. It starts innocently enough. A back injury, a dental procedure, or chronic pain leads to a prescription. Before they know it, they're hooked. The opioid crisis has hit particularly hard. It's been called the worst drug crisis in American history. But it's not the only problem. Cocaine, methamphetamines, and new synthetic drugs are all taking their toll. Each drug brings its own set of dangers and challenges. Together, they form a web of addiction that's incredibly hard to escape. This is the reality we face. It's a problem that touches all of us, whether we realize it or not. The world of drug abuse is vast and varied. Each substance brings its own dangers. Let's start with opioids. This category includes prescription painkillers like OxyContin and Vicodin. It also includes illegal drugs like heroin. Opioids are incredibly addictive. They create a feeling of euphoria and numb pain, but they also slow breathing. In high doses, they can stop it altogether. That's how overdoses happen. Stimulants are another major category. This includes cocaine and methamphetamines. These drugs create intense energy and focus. Users feel invincible, but the crash is brutal. Long-term use can lead to paranoia, heart problems, and severe tooth decay. Meth, in particular, can cause rapid physical deterioration. Users often age years in just months. Then there are the newer threats. Synthetic opioids like fentanyl are incredibly potent. Just a tiny amount can be lethal. Dealers often mix it with other drugs to increase potency. This makes overdoses even more likely. Synthetic cannabinoids, sometimes called spice or K2, are another danger. These man-made chemicals mimic the effects of marijuana, but they're far more unpredictable and dangerous. Prescription drugs aren't just limited to opioids. Benzodiazepines like Xanax and Valium are widely abused. They're meant to treat anxiety and insomnia, but they're also addictive and dangerous when misused. Stimulant medications for ADHD like Adderall are often abused as study drugs. Each of these substances affects the brain and body differently, but they all have the potential to destroy lives when abused. The workplace feels the impact too. Drug abuse leads to decreased productivity and increased absenteeism. It also raises the risk of workplace accidents. Economist, the healthcare system bears a huge burden. Emergency rooms deal with overdoses and drug-related injuries. Treatment centers struggle to keep up with demand. All of this comes at a massive cost to society. The numbers are staggering. The National Institute on Drug Abuse estimates that substance abuse costs the U.S. over $600 billion annually. This includes healthcare costs, lost productivity, and crime-related expenses. To put that in perspective, it's more than the entire GDP of Sweden. It's a drain on our economy that affects everyone, even those who never touch drugs. But the true cost goes beyond dollars and cents. It's measured in broken dreams and lost potential. How many brilliant minds have been dimmed by addiction? How many families have been torn apart? How many communities have been hollowed out by the drug trade? These are the hidden costs that don't show up in economic reports. They're the reason why addressing this crisis is so crucial for our nation's future. Section 4. Fighting Back. Government and Family Interventions. The government has a crucial role in combating drug abuse. At the federal level, agencies like the DEA work to disrupt drug trafficking. The FDA regulates pharmaceuticals and works to prevent prescription drug abuse. The National Institute on Drug Abuse funds research into addiction and treatment. These efforts are important, but they're just part of the picture.
State and local governments are on the front lines. Many have implemented prescription drug monitoring programs. These help prevent doctor shopping for opioids. Some cities have opened safe injection sites. These controversial programs aim to reduce overdose deaths and connect users with treatment. Drug courts offer alternatives to incarceration for nonviolent offenders. The idea is to treat addiction as a health issue, not just a criminal one.
But government can't solve this problem alone. Families play a crucial role in prevention and recovery. Open communication about the dangers of drugs is essential. Parents need to be aware of the warning signs of drug use. They should know how to access resources if they suspect a problem.
For families dealing with addiction, support groups can be a lifeline. Organizations like Al-Anon and Nar-Anon offer help for loved ones of addicts. Recovery is a long and difficult process. It often requires professional help. Inpatient and outpatient treatment programs can be effective, but they're often expensive and hard to access. Many families struggle to find and afford quality care. This is an area where more government support could make a big difference. Expanding access to treatment and recovery services is crucial. It's an investment that could save countless lives and billions of dollars in the long run.
Section 5. The shadow economy, cartels, and the drug industry. Behind the tragedy of addiction lies a vast criminal enterprise. Drug cartels operate like multinational corporations. They have complex supply chains and distribution networks. They use violence and corruption to maintain control.
Mexican cartels dominate the trade in heroin and methamphetamine. Colombian cartels still play a major role in cocaine trafficking, but the landscape is always shifting. The rise of synthetic drugs has changed the game. Fentanyl, for example, is often produced in Chinese labs. It's then shipped to Mexico for distribution into the United States. This global supply chain makes it incredibly difficult to disrupt. Cartels are also adapting to new technologies. They use encrypted communications and cryptocurrency to evade detection. Some even employ submarines and drones to smuggle drugs.
The financial scale of the drug industry is staggering. Estimates vary, but the global illegal drug trade is believed to be worth hundreds of billions of dollars annually. In the United States alone, Americans spend nearly $150 billion on illegal drugs each year. This money fuels violence and corruption around the world. It undermines governments and destabilizes entire regions.
But the drug trade isn't just about shadowy cartels. Legal pharmaceutical companies have played a role in the opioid crisis. Some have been accused of downplaying the risks of addiction. They've engaged in aggressive marketing tactics to boost sales. This blurring of lines between legal and illegal drugs complicates the picture. It raises tough questions about corporate responsibility and regulation. The drug industry, both legal and illegal, is a complex web of money and power. Untangling it will require effort on many fronts.
Section 6. Breaking the cycle, preventing future generations from addiction. Prevention is key to breaking the cycle of drug abuse. Education is the first line of defense. Schools need comprehensive drug education programs. These should go beyond simple just say no messages. They need to teach about the science of addiction. Kids should learn about how drugs affect the brain and body. They need to understand the real-world consequences of drug use.
But education alone isn't enough. We need to address the root causes that lead to drug use. Poverty, trauma, and mental health issues all play a role. Programs that provide job training and mental health support can make a big difference. After-school programs and community centers give kids positive alternatives. They provide safe spaces and mentorship opportunities. Family dynamics are crucial. Children who have strong bonds with their parents are less likely to use drugs. Parents need support in education too. They should know how to talk to their kids about drugs. They need to learn the warning signs of drug use. Programs that strengthen families can have a ripple effect through communities.
Finally, we need to change the way we think about addiction. The stigma around drug use prevents many people from seeking help. We need to treat addiction as a health issue, not a moral failing. This means expanding access to treatment and recovery services. It means supporting harm reduction strategies like needle exchange programs. By treating addicts with compassion and offering real help, we can break the cycle of shame and secrecy that fuels addiction. Only by working together on all these fronts can we hope to create a future where fewer people fall into the trap of drug abuse.